The mechanism of injury of a concussion is a direct blow to the head. It doesn't have to be just to the head. You can hit any part of the face or upper body, and as long as force is transmitted to the brain, you can get a concussion. A concussion is a traumatic brain injury that is associated a lot of times with athletic activity. So it's important for all of us that are involved with athletes, whether we're physicians, coaches, parents, to be on the lookout for the signs and symptoms of a concussion, both in practice and in games. What defines a concussion? When you have a blow to the head, you will see immediate onset of signs and symptoms. One of the first things you may notice is the athlete may come off the field looking a little bit dazed or being a little bit wobbly or have some problems with balance. Nausea or vomiting are other important signs, blurred vision, being disoriented, not knowing where they are or not knowing certain aspects of things they should know about what quarter it is or what point of the game, what the score is, other aspects of what's going on around them. Amnesia is another important symptom. They may forget things that have happened since the hit or may forget things even that happened before. Another important thing is loss of consciousness. They may actually be knocked out. There's two really important things to know about managing concussions on the sideline. One is that a concussion, when it's suspected or diagnosed, that athlete should not go back into the contest until they've been evaluated by a physician or a healthcare provider who's familiar with the treatment of concussions and can come up with a return to play plan. So even if their symptoms recover quickly on the sideline, we don't put those athletes back out there, because a repeat concussion quickly after a previous one can result in even a worse concussion or rarely even death, and that's called second impact syndrome. Another important thing to know is when somebody should be transported to the hospital immediately. A couple of things that can indicate that are one, if their pupils are unequal in size. So if one pupil is bigger than the other, that could be a sign of a serious brain injury. They need to go to the hospital immediately. Another is worsening symptoms. So if they came out of the game and they had a headache, but while they're on the sideline, they're getting nausea and vomiting, they're seeming to get worse, that person needs to be transported immediately by EMS to the hospital. Loss of consciousness is another sign that there's been a severe injury and they need to be evaluated immediately at the hospital. Any prolonged disorientation. So a lot of times after a concussion, someone will come out of the game and they'll quickly clear up and really the symptoms will wear off quickly. But if people are disoriented for a long time or getting more disoriented, they need to go to the hospital. Basically, any symptoms you see that are actually getting worse and not better, that's an indicator that that athlete may have a serious brain injury and needs to be transported immediately to the hospital. Another one is seizure activity. Any convulsions or seizure activity, that is an immediate transport to the hospital. After concussion, when can somebody go back to sports? It's complex and it's different for every athlete. Importantly, it needs to be a supervised return to play program by a healthcare professional who has a familiarity with managing concussions. It's not as simple as just saying sit out a week, here's a note, and then go back to play. An athlete needs to be symptom-free for a given amount of time as decided by the healthcare professional before they can even consider returning to play. And then they need a supervised, gradual return to exertion protocol. And there are specific protocols that we use, starting out with looking at their exertion and seeing with exertion if they have symptoms. Sometimes people will feel good, and then when they try to, say, go ride an exercise bike or go for a run, they'll get headaches again. So we gradually return them back to sports. During the time period when they're symptomatic, full rest is important. That's rest of their body, but also rest of their brain. And cognitive rest means taking a break from any sort of thing that uses intense brain activity, whether it be video games, watching TV, reading, or texting. Anything that exerts your body or exerts your brain can make the symptoms worse. So we need a period of rest for the athlete, and then a period of rest that allows their symptoms to go away. And then once their symptoms are gone, a physician or healthcare provider who's familiar with the care of concussions can help them work their way back into sports.